Yeah, just a quick review of the Vive squeeze balls for hand therapy. Um, Basically, this is a set of 4 squeeze balls. You put them in your hand, you squeeze them, although there's other things you can do with them, I'll tell you in a minute. But they're with 4 different resistances. And they're made of this thermoplastic elastomer. So really durable. Basically, there's 4 resistance. Now here again, most people are going to use these to strengthen their hands, but you can also use them for stress balls too. Just to squeeze them to decrease stress. So the 2 main reasons you would buy this, other than maybe if you want a fancy looking paperweight, is either to strengthen your grip or just for stress relief. Now, things you can do with these. Obviously, the picture, everybody picks it up, starts squeezing it. That's the number one thing people do. But you can also use these things to press down on, which provide a certain amount of resistance for your finger muscles. And you can also put them between your fingers, the lighter ones, and squeeze them and provide some resistance for the different finger muscles. So they're pretty versatile, actually. Most people just think of squeezing it, but there are other things you can do with this. They do come with 4 levels of resistances, which I really like. The light blue is the soft one. The aqua colored one is medium resistance. Blue is kind of hard, and then the other one, the dark blue, is like extra hard. So here's why that's so important. If they sold you just one of these, okay, and you did the light one, you could, let's say you can squeeze that thing for 2 minutes, okay? And you next month, next week you squeeze again for 2 minutes, next time 2 minutes. Well, you're not gonna get any stronger because your muscles say, hey, look, I can already squeeze that thing for 2 minutes. I don't need to get any stronger. I don't need to lay down any more muscle fiber or anything to get stronger because I can already do what I'm asked to do. So if you wanna get stronger, what you have to do is you have to give it a reason, the muscles in your hand, a reason to get stronger. And you have to make things harder on them. So when you can do this one for, like, say, a couple minutes, then you switch to that one, and then you're like, whoa, hey, I can't do this for 2 minutes. I got to get stronger. And then eventually your body will, adapt and modify the muscle so that you can do this one for, say, a couple minutes. And then when you can do that, if you still need to get stronger, you move up to that one. So that's why I really like this set of 4, because you really get a lot of progressive resistance, which is really the name of the game if you're going to strengthen anything, any muscle in your body. If you're looking for a neat little program to do, like you have hand arthritis, there's some supplemental exercises that are important. I want to bring up real quick. This book, Treat Your Own Hand and Thumb Osteoarthritis. Not that many good hand arthritis books out there. This is actually probably one of the better ones. There's also, I think the same guy wrote one for thumb arthritis, which is really good. Getting rid of that stiffness. So here shows you how to make a homemade heating pack. That's no big deal. Heat's nothing groundbreaking, although it feels good. If you have hand arthritis. Range of motion exercises. So if you go to like an occupational therapist or a hand therapist and you have a hand problem, they're going to give you range of motion exercises. So why is that? Well, basically, a lot of people don't know this, but your fingers are actually synovial joints, and they contain something called synovial fluid in the joint. What this synovial fluid does, one of the main things is it provides the nutrition to the joint, okay? So how does this synovial fluid get spread around to all the parts of the articular cartilage in the joint? It's by motion, which is a problem when you have hand arthritis because your hand hurts and you don't want to move it through the full range, and you don't want to move it at all. So that articular cartilage doesn't get spread, the synovial fluid doesn't get spread around as much as it should. And so you get parts of the cartilage that don't get the proper nutrition. So here again, and that creates more problems for your fingers. So that's why range of motion exercises are kind of a mainstay of any kind of therapy. This whole thing is a short little program. Take you less than 10 minutes a day to do. The range of motion exercises are really easy. Don't need any special equipment. How to make your hands stronger? Well, the squeeze ball is one way. They also show you with a really light dumbbell some things you can do, working on your pinch. Interestingly enough, people who have like base of the thumb arthritis, big problem as you get older, especially in females, after menopause, you get those hormone changes. And so what happens is sometimes the ligaments get a little more lax because of hormone changes. And so ligaments hold bones to bones. And so if those ligaments aren't as tight as they should be, basically you get excessive motion and that starts breaking down the articular cartilage. So here again, the problem is one of instability. What you can do, or if it's overuse, you get instability. Even in the later stages, they get so much extra motion that the ligaments start to even shred. I've seen pictures of that. And then the whole joint, the bone kind of slips out of place and gets deformed. So that's kind of the later stages. and can help avoid that. There is a couple of muscles. This in this book, this has one of them, your abductor pollicis longus. You can see how that attaches right to the base of the thumb. That helps support the joint and control the instability that you can get from ligamentous laxity and arthritis. So if you strengthen that muscle, you'll get a good stable joint. You'll have less pain. You won't have any, well, less progression of any problems of the arthritis. So here's an daily exercise for that with progressive resistance. Yeah, a lot of things you can really do for hand arthritis if people just knew what to do. But yeah, these are really cool. These are to get people to exercise, throw them an exercise ball. There's a lot of things you could do with it. They're fun to work with. I highly recommend them, so definitely check them out.